Now we'll look at the symptoms. So in the symptoms, we'll commonly see this generalized tonic-clonic movements in most of our patients, and the patient's eyes go upwards. There is frothing from the mouth deviation takes place. All these are common manifestations of generalized tonic-clonic seizure. But sometimes patient can only lose consciousness and have some staring. So this is called as partial seizure or absent seizure. So these absent seizures are seen in childhood very commonly. Therefore, seizures can affect any age group, right from the pediatric age group to the adult age group and in the elderly population. So in the neonatal age group, newborn baby also can have epilepsy, and epilepsy can occur in childhood, adulthood as well as in elderly population. So that is regarding the clinical symptoms. Then one more important point to understand is the investigations. How do we evaluate the patient with any patient with epilepsy? See, whenever the patient comes to the OPD with the history of epilepsy, one thing most important is the history. So we try to take the history from the patient if the patient remembers the event, but if the patient has forgotten the event or is unaware, then we try to collect the information from the family members. So if the family members give us proper information, that is helpful for us to make a diagnosis. Nowadays, we encourage the attenders to have the videos of the seizure episodes recorded in their mobile phones, which they can show us when they come to the OPD. That also helps us so much to make the accurate diagnosis of epilepsy. And then after evaluating the patient with the history, the next thing is to look at the blood biochemistries, as well as we go for imaging. In the imaging, we have CT scan and MRI, which are the basic imaging modalities with which we can make the diagnosis. We also have the EEG, which is also helpful for us to make the diagnosis of epilepsy. So these are the different basic investigations which we do for epilepsy. In certain advanced situations where we are not able to get proper evidence, we may take use of other investigations like the SPECT and the PET scans, which are higher imaging modalities. So this is regarding the clinical symptoms, history and the investigative approach to epilepsy. Thank you.